One of the things that I love the most is getting a little hand-drawn note or a cartoon from a young patient with a drawing of me and a drawing of their ear and a smiley face. That sort of thing makes me happy. Hey, I'm Dr. Neal Jackson. I'm an ear and skull-based surgeon, otherwise known as a neurotologist. I've always been fascinated with some of the really microscopic anatomy of the head and neck region. On a day-to-day basis, I help people with ear problems. Could be ear infections or difficulty hearing. And in my field, I get to help a lot of people, whether it's in the clinic with getting the right treatment or in the operating room doing the right surgery. The ability to restore hearing to a patient is really incredible, and the technology has come a long way. Today, the cochlear implant is so advanced that we can take a newborn baby who was born deaf and give them cochlear implants. And for most kids, by the time they're in first grade, they pretty much are mainstream. Hearing is a really fascinating sense that we have. And I think many people take it for granted until they've lost it. And so anything we can do to help patients, whether it's with medicine or with surgery or with an implant, can really go a long way in improving the quality of their life and the quality of their relationships.